This is my happy song. I like to sing it all day long. I'll teach you the words, then you can sing along. Happy, happy, happy.
Good morning, Mom, and good morning, classmates. We are Group 4, and today we will be discussing the peptic ulcer and GERD. We will be showing you its signs, symptoms, treatment, and prevention. Hope you enjoy. A peptic ulcer is a painful, open sore that may affect and develop on the inside lining of the stomach, as well as the upper part of our small intestine or duodenum. It is usually caused by non-steroidal anti-inflammatory drugs, or NSAIDs, or Helicobacter pylori or H. pylori bacteria, which may cause the stomach's defense against the acid to break down. In result, the stomach lining becomes damaged, which causes an ulcer to develop. Stomach ulcers may affect anyone, but people who are aged 60 and over are found to be more common of having it. In addition, men are more affected compared to women. There are three common types of ulcers. The first one is the peptic ulcer, which develops in the stomach lining or small intestine and are caused by an imbalance of digestive fluids. The second one is the duodenal ulcer, which is a type of peptic ulcer that is formed in the upper small intestine. The last one is the esophageal ulcers, which develop on the inside of the esophagus. Peptic ulcer affects about 4 million people worldwide and has an estimated lifetime prevalence of 5 to 10% in the general population. In the United States, approximately 3,000 deaths are caused by duodenal ulcer and 3,000 for gastric ulcer.
Peptic ulcer are open sores that develop on the inside lining of your stomach and the upper portion of your small intestine. Many people with peptic ulcer do not even have symptoms. Less often, ulcers may cause severe signs or symptoms, such as burning stomach pain, which is the most common. It is burning or gnawing pain that develops in the tummy or abdomen. Nausea, which is the feeling of an urge to vomit. Loss of appetite, which occurs when you do not feel hungry or have the desire to eat food. Intolerance to fatty foods. This is when your body refuses to accept fatty foods. Vomiting. If the person has severe ulcer, their vomit will have blood or the vomit will look like coffee grounds. Burping or hiccuping a lot. Black or blood bowel movements. This happens because the stool has blood in it. Heartburn, which is burning feeling in the chest, which is caused by the acid moving up to the throat. Indigestion. It is a pain or discomfort in your upper abdomen or body pain behind the breastbone. Treatment for peptic ulcers vary depending on the cause. Treatment can be antibiotics. Antibiotics are medicines that fight infections caused by bacteria in humans and animals by either killing the bacteria or making it difficult for the bacteria to grow and multiply. It can be used as treatment for peptic ulcers as it can kill bacteria Helicobacter pylori or H. pylori, the bacteria that causes peptic ulcer. Proton pump inhibitors are simply called as PPIs. Are medicines that work by reducing the amount of stomach acid made by glands in the lining of your stomach. H2 blockers are also called histamine receptor blockers or H2 receptor antagonists. Block a natural chemical called histamine, which tells your stomach to make acid. Bismuth, which covers the ulcer and protects it from stomach acid. Furthermore, it can help kill H. pylori infections. Surgery. If you have an ulcer that does not get better and keeps returning, you may have to need a surgery. You will need emergency surgery if you have a bleeding ulcer.
Protect yourself from infection. It's not clear how H. pylori spread, but there are some evidences that show that it can be transmitted from one person to another or food and water. This is why washing our hands is important, especially before and after eating and after going to the bathroom. Eat foods that are high in fiber. Fiber can lower the amount of acid in your stomach, while easing pain and bloating. Research has shown that by eating foods with high fiber such as oatmeal, pears, beans, apple, broccoli, and more, it can prevent ulcer. Avoid alcohol. Alcohol may irritate and destroy the mucous lining of your stomach. Furthermore, it increases the amount of stomach acid produced. Do not ignore ulcer symptoms. If left untreated, peptic ulcer may result in infection, digestive tract obstruction, and internal bleeding. When you have signs or stomach of an ulcer, you should go see a doctor, especially if serious, it may require surgery.
An ulcer is an open sore that may affect and develop on the inside lining of the stomach and the upper part of the small intestine. It is usually caused by the non-steroidal anti-inflammatory drugs or Helicobacter pylori bacteria, which may cause the stomach's defense against the acid to break down. In result, the stomach lining becomes damaged, which causes an ulcer to develop. It has three common types, which are the peptic ulcer, duodenal ulcer, and the esophageal ulcer. It is more prone to people who are 60 years old and above and affects men more. Peptic ulcer affects about 4 million people worldwide and has an estimated lifetime prevalence of 5 to 10% in the general population. In the United States, approximately 3,000 deaths are caused by duodenal ulcer and 3,000 for gastric ulcer. Its common signs and symptoms are burning stomach pain, nausea, loss of appetite, vomiting with blood, intolerance to fatty foods, burping or hiccuping a lot, heartburn, black or bloody bowel movements, and etc. Treatments may be provided such as antibiotics, which can be used to cure ulcers caused by H. pylori bacteria. PPIs, which includes esomeprazole and omeprazole. H2 blockers, which blocks a natural chemical called histamine. Bismuth that covers the ulcer and protects it from the stomach acid. Surgery if you have an ulcer that doesn't get better and keeps returning. You may need a surgery, etc. Furthermore, it can be prevented through washing your hands often, avoiding products with large amount of tobacco, being cautious with aspirin or NSAIDs, and avoiding alcohol and smoking, etc.
Gastroesophageal reflux disease, or simply GERD, happens when stomach acid rushes back into the passageway that connects your mouth and stomach on a regular basis. Acid reflux can damage the lining of your esophagus. GERD is defined by symptoms with or without tissue damage, caused by frequent or extended exposure of the esophagus lining to the acidic or non-acidic stomach contents. If there is tissue destruction, the person is considered to have esophagitis or erosive GERD. Non-erosive GERD is defined as the presence of symptoms but no visible tissue damage. GERD is frequently accompanied by symptoms such as heartburn and acid regurgitation. Yet, there are situations when there are no obvious symptoms, and the presence of GERD is disclosed only when difficulties arise.
Most people are able to manage the discomfort of GERD with lifestyle changes and medications. And though it's uncommon, some people may need surgery to ease symptoms. Common signs and symptoms of GERD include upper abdominal or chest pain, experiencing pain in the upper abdominal or chest, heartburn, burning feeling in the chest which is caused by the acid moving up to the throat, having trouble swallowing, having a hard time to swallow, acid regurgitation, contents from your stomach moves back up to the esophagus, loss of appetite, losing the will to eat, Persistent vomiting. Always vomiting.
Treatment and prevention. There are 4 approaches for gastroesophageal reflux disease treatment, which are lifestyle and dietary changes, medication, endoscopic therapy, and surgery. Often, patients respond well to a combination of lifestyle changes and a medication regimen. Some patients do not find satisfactory relief from those methods and require surgical intervention. Other patients may choose surgery as an alternative to a lifetime of taking medication. GERD treatment. Lifestyle and dietary changes. Dietary and lifestyle changes are the first step in treating GERD. Certain foods make the reflux worse. Suggestions to help alleviate symptoms include: lose weight if you are overweight. Of all the lifestyle changes you can make, this one is the most effective. Avoid foods that increase the level of acid in your stomach, including caffeinated beverages. Avoid foods that decrease the pressure in the lower esophagus, such as fatty foods, alcohol, and peppermint. Avoid foods that affect peristalsis, the muscle movements in your digestive tract, such as coffee, alcohol, and acidic liquids. Avoid foods that slow gastric emptying, including fatty foods. Avoid large meals. Quit smoking. Do not lie down immediately after a meal. Elevate the level of your head when you lie down. GERD treatment. Medication. If lifestyle and dietary changes do not work, your doctor may prescribe certain medications. There are 2 categories of medicines for reflux. One decreases the level of acid in your stomach, and one increases the level of motility in the upper gastrointestinal tract. Antacids. Over-the-counter antacids are best for intermittent and relatively infrequent symptoms of reflux. When taken frequently, antacids may worsen the problem. They leave the stomach quickly, and your stomach actually increases acid production as a result. Histamine blockers. Histamine 2 blockers are drugs that help lower acid secretion. H2 blockers heal esophageal erosions in about 50% of patients. Proton pump inhibitors. Proton pump inhibitors are drugs that block the 3 major pathways for acid production. PPIs suppress acid production much more effectively than H2 blockers. PPIs heal erosive esophagitis in many patients, even those with severe esophageal damage. Prokinetic agents. Prokinetic agents are drugs that enhance the activity of the smooth muscle of your gastrointestinal tract. These drugs are somewhat less effective than PPIs. Your doctor may prescribe them in combination with an acid-suppressing drug.
The easiest way to prevent GERD is just simply having a healthy lifestyle. You should quit smoking. A study has shown that out of 1 for 1 former smoker, 43.9 reported less GERD 1 year after quitting. Avoid fatty, acidic, and fried food. Fatty, acidic, and fried food may all cause heartburn, which may lead to reflux as they prevent the lower esophageal sphincter from fully tightening. Losing weight. Weight increases the pressure on the abdomen, and the extra fat around the belly squeezes your stomach. In result, more fluid will travel upward into the esophagus, which will make it more likely for you to experience stomach acid leakage and GERD.
Gastroesophageal reflux disease, also known as GERD, happens when your esophagus repeatedly allows your stomach acid to flow back up into your mouth. GERD can affect people at any age, but it may be more prone to some people compared to others. For instance, after age 40, you have a higher chance of developing mild or severe GERD. If GERD is left untreated, it can worsen since the stomach acids damage the esophageal lining over time, which causes inflammation and discomfort. Some common signs and symptoms of GERD includes the pain of the upper abdominal and chest, heartburn, trouble swallowing, loss of appetite, acid regurgitation, and persistent vomiting. Its treatment include H2 blockers that helps reduce acid production, antacids that provides quick relief, and PPIs that allows time for the damaged esophageal tissue to heal. GERD can be prevented in ways such as quitting smoking, losing weight, and avoiding fatty, acidic, and fried foods.
This concludes our report for peptic ulcer and GERD. Thank you for listening and hope you learned something new today.
No one told